For more on this story, we can go across to Yousra Semmache, Advocacy Director at Save the Children. Thank you very much for joining us here on France 24. Do you realistically believe that this ceasefire can hold?
So we heard already, we of course welcome this announcement. It is crucial at this moment that a ceasefire is implemented. We know that there has been before, about 2 weeks ago, announcement of a ceasefire that didn't result in de-escalation of violence, with scores of civilians, including children, losing their lives. And it is important that this time the parties to the conflict get it right and ensure that a halt in violence helps the country prepare for a coronavirus outbreak.
Now, you know, the situation in Yemen was dire before the coronavirus began. What needs to happen on the ground to prevent the spread of the virus?
So currently only half of the health facilities in Yemen are still working. The country's healthcare system has been entirely decimated by 5 years of war. There are only 700 intensive care units beds, including only 60 for children. What needs to happen at the moment is to ensure that first, we prevent an outbreak by building awareness amongst the communities around key prevention measures, but also we need to train the healthcare workers to be able to screen and refer different cases and ensure that also supplies gets to the hospitals to have them prepared for a potential outbreak.
You know, what can the international community be doing, considering that everyone is battling the coronavirus pandemic at this time?
So first of all, we need to make sure that this ceasefire holds, because if violence continues in Yemen, hospitals will have to close, healthcare workers will not be able to go to the hospital, and patients themselves will not be able to get to these hospitals. Hospitals have been I would say routinely hit during this war, and therefore it's not considered as a safe place for patients, for people. And what we're also calling the international community is on funding for preparedness and response to a potential coronavirus outbreak, but also ensure that Yemen humanitarian activities remain funded, as the population is already vulnerable to preventable diseases such as cholera. We also know that the economy has entirely collapsed, and it's important that in what is a country where this outbreak will be absolutely catastrophic, that we make any effort that is possible to ensure that we're ready and prepared to respond.
Very quickly, do you have the necessary equipment, you know, the masks, the gloves, etc., for frontline workers? Because that seems to be the problem even in developed countries.
Exactly. So there's already very few PPE equipment that will be available. As Save the Children, we're trying to ensure that the hospitals have at least some training, some level of preparedness, but it is important that access is also facilitated within the country. We know that supplies already are very hard to get in Yemen, and it is more important than ever to ensure that these access issues are also resolved, as well as increase funding to ensure that the health sector is able to prepare adequately.
Yousra Semmache, we're going to have to leave it there. Thank you very much for joining us here on France 24.